Well, welcome to another episode of Healthy and Active in the Couve. I am a certified personal trainer through NASM. I'm also a certified nutrition coach, and I work at Northwest Personal Training. My name is Nick, and with me, as always, is Dr. Trent Corey. And how are you doing today?
Doing amazing there, Nick. How are you doing? Doing amazing. Just a good day to live in the coop. It's a beautiful summer day right now as we record this, so it's been awesome to kind of be able to share. So,
Yep, nice and sunny for once, and so you got to get out and enjoy the weather and get all the vitamin D started in your body. But I was thinking today we were going to talk about the core and the pelvic floor. Since last time we talked about hips and everything, we're just working our way up the body. It's kind of like the anatomy, from the knee bone is connected to all that kind of stuff. So we're just working our way up. So I was thinking, because I've got a lot of experience with my clients coming in, trying to get a better sense of their body as far as their core, their pelvic floor, going into, say, a surgery like a hernia surgery or a hysterectomy or something like that. Or even a sudden surgery like an appendicitis and having to have their appendix removed. And they want to either I call it prehab, get everything going before the surgery or before an event, or rehab after they're done working with the physical therapist or alongside the physical therapist. So I've been asked a lot about this topic, and so I've developed some ideas and some different exercises and looked up a lot of things. So that's something I'd love to work on. And I know with chi running that we've talked about before, the core is essential with breathing and all of these different things. So that's what I'm going to shoot for today.
okay, sounds amazing, Nick.
Uh,
Wonderful. Yeah.
okay. So from an anatomical point of view, I'm just going to talk about the pelvic floor as something at the bottom of what I'm going to consider like a barrel. I'm going to think of the bottom of the barrel as what kind of holds the intestines and holds the organs and holds everything in. And then the outsides of the barrel are more of like the side muscles, and then the front muscles, and then of course the diaphragm is kind of like on the top of everything. So there's a lot of things in that when I used to think of core before I was a personal trainer, I thought of just like abs and doing sit-ups as like core work, and it's so not specific to just the front part of your body. So we have all of these different muscles that help stabilize our spine. But and when the more I got to develop the thinking of the core, it was just then supporting the spine. And I heard this phrase that the pelvic floor is the forgotten base of the core, and I kind of liked that idea because that way the core wasn't just this circle around the spine this way. We've got everything that holds from the bottom. So it's super important to have all of these things in my head to connect the hips to the spine and the organs being supported. And when you don't have that, you've got, bladder leaks, and you've got different things that don't support you, and organs can even prolapse and things like that. So it's a super important thing that a lot of people don't talk about necessarily out loud, but you kind of, whisper, I've got this thing that I need to work on. So Kegel exercises are a big part of that kind of an exercise, but guys have all of those issues too. So like before, when I was starting in training, Kegel exercises were just like thought of for women, and now the more we explore things, guys have a huge part of that, especially like post prostate surgery, like prostate removal. A lot of things happen. You have like bladder, leaks and control issues like that. So that's why I think it's so important. And I've got a lot of clients that have surgeries, and going into that, I'm always saying, let's really support everything that we have. So do you have any particular ideas for exercises? Because I've got a lot of exercises that I like to use.
Well, first of all, Nick, I mean, like, it's definitely an important area. We definitely need to take advantage of understanding the importance of like what we're trying to do to stabilize certain areas. A lot of times things are actually chronically tight. And this is something I'm gonna completely claim. I'm not a pelvic floor specialist. There's so many good PTs out there, and it's very important. So many people out there in the world are saying those things about the most embarrassing things about like leakage, and you laugh and you sneeze and you pee a little bit, and it's not funny. Like, you just kind of learn to live with it. Well, a really gifted physical therapist who can work internally and give you some feedback on what you're doing, where you're chronically trying to squeeze too much. And actually, a lot of the PTs will tell you not to do the Kegels. Kegels
Yeah,
sometimes can actually screw things up because you're over contracting, you're doing things wrong. And so you need some feedback with that. And that's where a really skilled hand of a really, and I'm kind of, nobody local that really comes. Actually, there's a couple people I might think about in mind, you could go to, but like, that it's such an important thing to have that done. If you're a man or a woman, they basically can work on all these different things, and that will get you to the point where things are a lot better. And all it is just feedback. And that's all we do in PT, just trying to get feedback on how you're moving correctly. And sometimes if you don't know what you're doing, you can actually provoke and make the issue worse. So if I tell you something, I don't feel like I'm in the right vein to do that. What I will look at though is how the whole body's integrated, right? So, and I go to this all the time. So if we're doing a little podcast talk on the ankle or the shoulder or whatever, wherever we're going next, I'm going to say this next too, just so you understand, right? Okay, we're talking about the hip today. Well, guess what I'm going to say? I'm looking at whole body symmetry. Look at how your body, whole line tension left, whole side tension right, whatever, all those things need to balance sideways, all these different rotate, from the hip to the shoulder, how those things are integrated. And if you're skewed off right or skewed off at a certain twisting motion or anything in that three-dimensional realm, like you were just saying, hey, this whole thing's a three-dimensional structure, and we all are. And then we have those fascial planes that go through that. The psoas from the hip all the way into the core. That's definitely a core muscle. It's going through that area. All the connective tissue that goes through there. So the more we can kind of get all those parts moving correctly, now you put your body in a better position to start to activate in the way we need to. And that's what's going to help everything work together. I think a lot of us get very myopic in what we're trying to do to isolate a certain area. And it's just not the right way to do it. There's some parts that we can do to get, some ideas of kind of getting that going. But if you don't look at the thing as a whole, or you just do functional movement patterns and kind of get people rolling on the floor, for example, I have people do this all the time. Just lay on the floor and just see if you can like roll on the floor without using your legs, let's say. Okay, so you
right.
lift your arm up and then you just try to roll yourself over. Actually, a lot of people find that that's pretty difficult, especially when they're on their belly and they're kind of going back over. But we're
Hmm.
trying to do this because this is going from the developmental pattern from a baby trying to roll on its back. That's kind of the first phase. Well, first of all, we're laying there, we're a little baby, not doing anything, and then all of a sudden we're moving our neck, right? So we're moving our neck. Then the next thing is starting to roll, then to crawl, then to kneel, and then stand, right? And so all those things are little things along the way. But if we can start working on all these different whole body patterns, we can see some of these things start to improve. So that's usually where I start people, and it gives people a good chance to see what else is happening. But if there's something else that's a little more in depth that I feel like it's not my lane,
Yeah,
I know that, and that's one thing. I work with runners, and then people have stress incontinence, and so this is a pretty important thing. And there's certain things that we can work on, but definitely not getting, same thing with mental health and all this stuff, right? Like the stigma, the idea of that stigma of this kind of thing being an embarrassing thing, you should just get past yourself and realize you need to get help, and
yeah,
that's okay, and get the help you need and get from people right? I treat runners. I'm really good at that. So like
yeah,
go with people who do this all day long. Find the right people. They are out there. And if you can get those folks, then you'll be definitely it's a process. It's a little bit, but they're very professional. They're able to do that in a way that, maintains your dignity.
yeah,
Understand that that's a huge issue, and I'm glad we've touched on this. At least people just don't think about this as being a big deal, but at least if we're talking about it more, people understand that, hey, this is not, just because something's common doesn't mean it's normal. And
Right.
so a lot of times, people will talk and they're like, "Oh yeah, I have that too. When I sneeze, I pee and or whatever. I'm trying to lift weight and I'm worried that
Right.
I can't jump on the trampoline because I'm worried I'm gonna actually have leak, that kind of thing."
Yeah.
So those types of things need to get past that whole thing and realize there is a solution. There are people who can help you. So yeah,
Yeah.
I know that was a long-winded tribe there, but
But
I feel like that was important, need to be said, and that's kind of
yeah,
how I feel, and that's my view of the kind of part of the body, and that's super important, and that the integrated part of the whole can actually help that area and get better with it. But then there's other folks that, working on those direct muscles that we're trying to get feedback on.
yeah,
Yeah.
I appreciate that a lot. Yeah, I don't. I love the idea to not have a stigma, to make it just a ability to talk to. Like, so a lot of my clients will freely talk to me now that they know who I
Yeah.
am and out, even though I'm a guy. You know.
Yeah. Yeah.
Now, especially me, I have to stay in my lane also. I can't diagnose, I can't do all of those things and say if you're hypertonic or hypotonic on those things. But what I can do is work on, in general, like in general, pelvic floor things go right in line with a lot of stabilizing the lower lumbars and things. Like I'll use the McGill Big Three, which is a lot of like really good lower lumbar core things, and everything I've studied for like the pelvic floor things, like squats are really good for it, bird dogs, and things that I do on a regular basis with every client. But then I have more intention and more breath work with people, but working alongside, especially if I have a pelvic floor therapist, which I don't know any in town here since I'm new to Vancouver. So hopefully we can add some people onto this podcast list in the comments, and maybe just start creating a chain of, hey, there's some good pelvic floor therapists in Vancouver or in Portland or around there. I'm really passionate about helping people really find good support when they need it, because I can only go so far in my lane. You can only go so far in your lane. But that's what I imagine we're here for, is to just either be who we are or refer to people who are specialists in that. But for me, I love that whole idea of everything's connected. And I've known some people who have had like hysterectomies and have had the sacral ligament, or what is it, the sacral uteral ligament, have to be reattached. And because of, say, endometriosis was so bad, it kind of shifted the sacrum around. So the movement patterns everywhere were different. And then they have to get used to afterwards, when the organs are placed in a different way, you have to move differently, and you've got to get used to your center of gravity being different. So I just think being, number one, aware. I know we're not talking about methodology of exercises, but even just the awareness itself, of knowing that, going into a surgery beforehand, you want to have a lot of the exercises to stabilize your body or stabilize your organs. And then afterwards, with a specialist for pelvic floor therapy, and then some kind of a coach to help continue it on, is super important. And but then to integrate it into the full system, like what we've said from day one, you're not just working on your belly button area, you're working on how it moves everything, like last time we were talking about, the more you're able to contract your core, it can open up your hips so that you can move a little bit better. So even that, you reminded me, and it's a little bit of a tangent, but we talk about the fascia a lot, and I was studying that even the jaw, if it's misaligned and your tongue is in the wrong place, the fascia all the way through the inside of your
Yeah.
body is going to be misaligned, and that can create different internal movement patterns that then, all of that can contribute, the as above, so below. If you're off here, you can have dysfunctions, in your pelvis that can lead to maybe even more bladder, issues.
Well, yeah, absolutely. I mean, you got people who are the craniosacral therapists who just do that. They do a lot of stuff in the cranium and it affects stuff in the sacrum. So that's back and forth. That's a reverberating cycle of how the fluid moves through that cycle, through the lumbar vertebrae and all the way up through the brain. But then also you have your NUCA therapists who are the chiropractors who just adjust C1,
Yeah.
C2. That's all they do all day. They just
Yeah.
look at C1, C2 and they adjust things, and things get dramatically better. There's also a branch of acupuncture that just does the ear, and they get dramatic things, and it wouldn't be around after 3,000 years if something had not had some sort of effect there. So there's some parts of there Also, another thing, I do another thing, you know about my chi running, but I also have studied extensively primal reflex release technique, which is about these kind of reverberating circuits through the body. All the things that we're trying to do, calming fight or flight, to fight or flight is kind of more driven through the jaw and the trigeminal nerve, causes tension in the jaw, reverberates the circuit into the upper trapezius, into the infraspinatus. All this kind of causes this upregulation of our system. And we did a class, I just did a refresher the other day, and we did one thing, and you mentioned the jaw. If you try to bend over and touch your toes, you can try this right now if you like. I don't know if I have room, but if you try to just stand and just bend and touch, and you can have people try it at home. But basically, if you're just trying to bend over and touch your toes, just see how far you can go. Just do whatever you can do. Notice where you are. And then as you do that, then on the way down the next time, you're actually going to do a jaw side to side. So it looks like this. You're just kind of going like this as you go down again. And so you do it again, side to side, side to side, side to side. And just take a note of it. Notice how far you're going. And what's fascinating is it actually tends to happen where things start to calm down. You can go a little further. All these things are impactful. And these are just kind of effects of just kind of a neat little, a little bar trick or whatever. But the idea
Yeah.
is like the concept is very strong. This has been backed by evidence. This isn't something that's just hearsay. This is how we need to look at how the whole system is. This is how blind spots get exposed, or we never see them because we're never paying attention to how everything's driven by your system and how you're going to survive. And if you don't calm that down, then your body's going to be guarding up more. So then you're kind of pushing uphill because you're trying to look at a spot in specific area. So that's kind of how I view everything. And so the more I can kind of get people to understand that philosophy, and that if you go from some other philosophy of that, great, you have a methodology, you need to do that. But I found that this is the best way to kind of get things calmed down first, then you can actually move, and then you can go from there. Like you just said, all the time with the breath work and all that stuff, super important. So great.
And get me so excited talking about things like that, Trent. It's awesome. And you're the one of the few people who've ever mentioned nuka therapy that I've been in contact with. And my wife actually did nuka therapy for a little while, and it's
Nice.
crazy because it gets me thinking so much. And this is the particular reason why we've got these tiny muscles everywhere. And for her, when she had adjusted in the nuka therapy, just that C1,
Yep.
she didn't use her glasses afterwards because
Hmm.
the some fascial connection was I don't have the words to describe it, but I know that it was a fascial connection. Some kind of muscle thing in her eye was able to either relax or change in
Hmm.
tone. And so her eyesight was better, and she didn't have to use her glasses for at least a couple of weeks in between sessions.
Hmm.
And so it changed some of your limiting beliefs that, okay, I've got to have glasses the rest of my life, or maybe not. I mean, maybe something is different that's going on, that's a systemic thing, rather than I'm just getting old and my eyes are deteriorating.
Hmm.
And then that, look at the whole body differently. And so that makes me be able to encourage people that age is just a number, and health is what we're really looking for, and full integration of our movement patterns. And even post surgery, yes, you have to do some different things, and you have to take care of all of your fascial adhesions
Hmm.
and massage to make sure that all of those adhesions and scar tissue doesn't you know wrap around the organs, because that's the thing that I was never told about when I had my appendicitis. But I know plenty of doctors and a lot of different practitioners that I'm asking all these things. So I find all these things out obliquely. But I just love having these conversations because I want to get all the information that maybe get glossed over in the hospital when you're in an emergency situation, and just more education and more awareness to people.
Yep, absolutely. I mean, that's what we're here for. We're all trying to learn more things about us. And, you kind of mentioned about beliefs, and it's like, a lot of it's like, really so many things are possible. Almost anything is possible, but according to your beliefs. So if you have a belief that, you're going to be just getting older and more deteriorated, your body, you're going to tend to kind of follow that way. And so having beliefs that, hey, you're resilient, you're strong, we're going to age, but we can actually age stronger and get better. And that's kind of but it's if you don't really believe that deep down, it's going to show. And so those things kind of are super important. And the more we can kind of get tapped into those ideas and those mindsets, it puts us in a better spot. You're definitely not trying to put a blind eye to what things you're seeing as you're in front of you, but the idea is trying to make sure that you're focusing on what you can do to become better in your future self. Like what does your future self look like? Do you look strong, dynamic, or do you look weak and old, and that kind of thing. So think about those kind of things. It's super important thing that tends to get glossed over because a lot of people just talk about it, but
Yeah.
it is something when you practice it. I've noticed firsthand it definitely makes a shift with people, and I can see it all the time in clinics where people are they have a certain mentality of what things are supposed to turn out to be, and then they kind of fulfill it themselves, even with but that's what's great about myself. I have a point of of influence, being able to direct their mind into more of a healing mode, which is kind of my job to do. So there you
Yeah.
go.
Well, that's awesome. I love that. You just got my imagination just going on so many things I want to talk about more. Some things maybe even trauma based, and I don't mean like emotional trauma. I mean in this case physical trauma, but how we even guard ourselves, like after maybe a surgery or after my
Yeah.
appendix. My appendix ruptured in 2020, and my nervous system I can feel in the
Yep.
fascial regions is still guarding that area.
Yep.
So I still have to work constantly to not have my pelvis shift. And so
Yep.
I do a lot of work, but if I overtrain certain parts of my core and isolate it, that part acts up because it doesn't want to release its basic being a guardian over that area.
Right, right. So your muscles are trying to guard that and protect that and move bones, but then also what's even deeper is the nervous system and the protection mechanism, and then the reflexes that kind of keep that shunted down. That's kind of what I'm talking about, the primal reflex release technique. You actually do quick releases of reflexes in the opposing direction. So for example, if it's an upper trap, you might do a quick move to do something to calm things down. It's done in a specific thing. It's done with timing. It takes a lot of training. I'm working through it, but it's actually found to be really helpful for that kind of stuff. And so this is exactly what we're talking about. When you don't have those things to reset, then you're always kind of in protection mode, and that's why you don't get that nice freedom of motion. So that's why we need to address those things first. If you have those things that are literally stored in your body's memory.
Yeah. Well, that's awesome. Well, I know we are starting to run out of time, but there's a couple of things that I love to do for just overall what I would say core that includes the pelvic floor, and I'm sure you've heard of them. What are your thoughts on the McGill Big Three?
Sure. I mean, those are just solid basic exercises that most people have hard time doing. And so as long as they're feeling safe to do those are going to be a good starting point for most people. So definitely not worth trying going through and making sure you're doing them in the right way as prescribed, making sure you're having no pain or compensations, and definitely a good place to get going.
Awesome. Well, I'll leave a link to the McGill Big Three
Okay.
below. But essentially, for people that don't know, it's a method of using a bird dog, some side planks, and some curl ups to really help stabilize. And like you said, in a no pain kind of a way, in a progressive way to really build strength without really straining any body parts. But it was developed for back pain and lower lumbar injuries specifically. But I use it on myself, and I don't have lower lumbar injuries, but it really feel solid a lot of the time. But last question, what I have heard that rebounding, like those rebound trampolines, really help develop a good base for the pelvic floor. Is that something? And since this is way out of my lane, I'm asking you: is that something that is contingent on having hypertonic or hypotonic muscles in the pelvic floor, or is it good in general?
So it just depends on the velocity, some people can only bounce from their knees, just not even jump and touch the ground, just kind of just literally just move. That's really good for lymphatics. So really getting everything flowing. It's almost like to catch a bottle. You get fluid through your body. Things are kind of gummed up. The lymph system comes up and drains into here, these 2 points here. So that's kind of where we want things to kind of move and shake to. So really good. But then if it's too much, then it's going to cause things to get too toned or like maybe too much of a velocity. So it just depends. You can kind of start light and then kind of build up. So, but I do love trampolining in general. It's a great thing. It's kind of fun to do, and it's a good workout. And there's a lot of things that are beneficial of it. So you kind of always bring it up to that level where you can tolerate it. So yeah,
Awesome.
great.
Well, fantastic. Well, we got to wrap it up, but I'm always excited to talk to you, Trent. It's so much fun, and I look forward to next time. Well, thanks for chatting with me again.
Of course, yeah, no problem, Nick. It was great talking to you too. All right.
I'll see you again soon.
All right, sounds good. Okay, great.